Hello there. Welcome to my show, COVID-19 update by Heerak for May 2nd, 2021. Today is Easter Sunday for Orthodox Christians around the world. Um, yes, so Catholics and Protestants celebrate Easter on the same Sunday, and there are uh, 1 billion Catholics in the world, uh, and um, Orthodox Christians and Protestants combined, there's like another billion Christians. Um, but Protestantism came out of Catholic Church. Martin Luther was a Catholic priest of the Augustinian tradition, which is similar to John Calvinism. And John Calvin was also an Augustinian Catholic priest. So that may explain why Protestant and Catholic Easter falls on the same Sunday. Orthodox Christians celebrate together today, May 2nd. And that's not just Greek Orthodox, because you may be most familiar with Greek Orthodox Christians, but there are Russian Orthodox, formal Christian religion of Russia is Orthodox Christianity. So if you visit Moscow, and I visited St. Petersburg as well. They actually have one of the best art museums in the world, Hermitage Museum in St. Petersburg, which is considered one of the best in the world, along with the Louvre in Paris and Metropolitan Museum of Art in New York. So definitely, if you love art, and I love art, um, you should visit Hermitage Museum in St. Petersburg in Russia. So Russia is mostly Russian Orthodox Christianity. And this is true of Armenia. Armenia is majority of them are Orthodox Christians. So Armenian Christians are celebrating Easter today as well, a majority of them. Um, and same with Orthodox Christians from Egypt, Coptic Orthodox Christian celebrate Easter today. Syrian Orthodox from the country of Syria, um, and Orthodox Christians everywhere. Other countries have Orthodox Christians as well. Ukraine, um, and other countries in 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 former USSR. Many of them are Orthodox Christians, and there are a lot of Orthodox Christians in America. And so happy Easter to everyone who's celebrating Easter today. And for Christians, every day is a celebration of the resurrection of Jesus. So in a sense, every day is a celebration of Easter. But we set aside one day per year to concentrate our celebration. And so that has meaning. Um, if you have never been to an Easter Orthodox Christian celebration, obviously you should definitely visit. And um, today, May 2nd, is a great day to visit an Easter celebration of Greek Orthodox, Russian Orthodox, Syrian Orthodox, Coptic Orthodox church. There may be one nearby you. There's a Orthodox church in Washington, D.C. I highly recommend it to participate in the celebrations there. Um, yeah, religion is very important for people. And for those of you watching my show, COVID-19 Update by Heerak, understand how important religion is to your life. And during COVID-19 crisis where over 500,000 people have died in America, religion has become more and more important to the American people. And so, and you may be realizing that for yourself. Maybe you have recommitted yourself to Jesus Christ during COVID-19. Maybe you are like a lamb that has strayed away from um, the shepherd, and now you were lost, but now you are found. And some of you may sing the song "Amazing Grace." I was once lost, but now I'm found. And then maybe with those of you who may be in high school, middle school, elementary, college, graduate school, young professionals, middle age, uh, senior citizens, people of all ages are returning to Christ in this COVID-19 America. In times of tragedy, people seek God, people seek religion, and that's just the basic human nature. And so,
essentially buy, sell crypto thousands of times a day, all day.
so yeah, when you think about the tragedy that is happening around the world, you realize that money doesn't really matter that much. I got a, I was told by a friend of mine who's Indian, um, we were friends at Georgetown University, and he was saying that his uncle died from COVID in January. Um, a lot of people have friends, relatives who are dying. They're realizing money really isn't that important. Because when you die, you die. You can't take your money with you. So many Americans are realizing that they need to invest in eternal life, life after death. So many people are kind of realizing what's really important in life is not money. Life is so precious. People are choosing to forego money and wealth to spend more time with children. Many moms have realized, what have I been missing out on? Being a feminist, focusing on work, ignoring my children, throwing them into daycare. And they realize they could die any moment from COVID. And they're thinking to themselves, maybe I should spend more time with my children, something that is more important. So a lot of women in America have gone um, to stay with their children and spend more time with them. Some are beginning to homeschool their children even. Because they're educated professionals and they're more than competent. If you have a bachelor's degree, you're more than competent to educate your children at home. You don't need a school really. And they said homeschooled children are much more bright than children educated in schools, both public and private, because you have one-on-one attention or one-on-two attention with mom and child. Um, so, some mothers are deciding to invest their time, energy, and brains on their own child. And they're beginning to see that there's a value in that. Because, you make money, you can make more money. At the end of the day, all you need is food, shelter, place to sleep, right? What is your quality of life, really? A lot of mothers in America are beginning to realize what is really important in life, right? Spend more time with my child, that's more important. You can make more money, but what's that gonna do? Is it gonna make you happy? I mean, you can't hug your money at night, your children, you can hug, you can spend time, memory, you can create beautiful memories with your children. And so a lot of mothers throughout America, in all 50 states, including Virginia and Arlington, Alexandria Falls, Church, and Fairfax County, a lot of mothers have decided to work at home, and some of them have decided to go half time or kind of pause and spend more time with their children because they don't know when they're gonna die. You don't know when you're gonna die. I mean, you die from all kinds of things like cancer, Over 1 million people get cancer every year, and over half of them die within few years after they're diagnosed. People die from heart attack. A lot of women are dying from heart attack too, or stroke. Um, and now that we have COVID-19, that it's just making people realize life is precious, and where do you want to invest your time, really, to make a few more bucks? If you have money saving up in the bank. A lot of women in Arlington, Alexandria Falls, Church of Fairfax County are saying, I'd rather spend more time with my child, I have enough money saved up. I don't really need that much more money. And so a lot of women in Arlington, Alexandria Falls, Church of Fairfax County have turned their back on feminism, the values of feminism, and they're beginning to realize that's what took away their joy um, in the past. And so we have a move toward the right in Arlington, Alexandria Falls, Church of Fairfax County, which I applaud because, as you know, I am a conservative. Um, lifelong Republican. I'm still trying to decide whether I'm going to run as a Republican or an independent, conservative independent in 2022. I'm already running for 2022 for congressional position in Arlington, Alexandria Falls, Church of Fairfax County, Virginia's 8th district. But Republican primaries is in March 2022. So I still have like 1 year to think about it and decide. So I'm just kind of running right now as independent, conservative independent, but I may decide to run as a Republican in the primaries and run in the Republican ticket. I don't know. I'm still thinking about it. Um, I'm praying about it, obviously. This episode is 13-month anniversary episode as well. We started the show COVID-19 update by Heerak on April 2nd, 2020. And, it's it's been a long time. Many of you probably had an isolated life like, most of us in America. Unless you live in Texas or Florida, maybe you do not have any isolation. you know, yeah, they're still alive. I know some of you liberals are like, you are like, kind of criticizing Florida and Texas, but it's not like, they have far more death than like New York or California. You know what I mean? It's um, I'm just pointing out the reality here. So yeah, I mean, facts are facts. Facts are facts. And so on that score, you gotta say Trump was right. Trump and his supporters are right. Yes, a lot of people died, people who are kind of, not wearing masks, but a lot of them did not die. uh, you know what I'm saying? It's you gotta decide what's more important in life. Because as you know, U.S. Declaration of Independence. We as Americans, we have the right to life, liberty, and pursuit of happiness, and you can't always have all three, right? When you choose life by wearing mask, and I like to wear mask wherever I am, um, because I think it makes practical sense to block out the virus from entering your nose or mouth. It's just so I encourage you to wear a mask too. So I disagree with Trump on that, but you know, um, maybe life is not the most important thing to you, right? Because there are three values for Americans. If you're an American, call yourself American, you know what I mean. We have the right to life, liberty, and pursuit of happiness. Sometimes when you pursue liberty, and a lot of people choose liberty, they may not have life. Like, for example, we as a nation, United States of America, pursue liberty through American Revolutionary War. A lot of people died because of our pursuit of liberty. And as you know, the famous saying, give me liberty or give me death. So obviously, when you're wanting liberty, sometimes you're willing to sacrifice life, right? So yes, we value three things: life, liberty, and pursuit of happiness. But sometimes people value liberty more. You know, in Virginia, one of the license plates says, "Don't tread on me." I like my liberty. You know, hands off my liberty. You know what I'm saying? And so some of the people who value liberty are willing uh, to die, possibly, for their liberty. And many people who don't wear masks, they language it in the sense like, I want to be free. I want to have my liberty. And they know that there are dangers. It's not like they're stupid. They know there are dangers, but they rather value their liberty by not wearing a mask. And yes, they know they're risking death, and they're taking that risk. So in a sense, they're valuing their liberty more than their life. And traditionally in the United States, that's been the case. People value their liberty more than their life. So history values our life, liberty, and pursuit of happiness, but they're not always equal, and you can't always have all three. I know Germans say alle gute Dinge sind drei. They say all good things are three, but sometimes you have to give up one or two, right? You can't have all three. Life is like that. And in America, we say three is a crowd. So in a sense, life, liberty, and pursuit of happiness, maybe three is a crowd. You can't always have all three. Pursuit of happiness as well. Some people like to go bungee jumping, extreme sports, and these are dangerous. You could get injured, you could break your neck, you could die. If bungee cord snaps, you could die. Some people like to go skydiving. I would never want to go skydiving. I mean, why would you want to jump out of a plane? I mean, geez, you know, what if the parachute doesn't work? I mean, it just doesn't make sense to me. But I know there are some people who like that kind of thing. And more power to you. This is America. You can pursue your happiness, by jumping off a plane, parasailing, skydiving, whatever. If you like it, you may be risking your death, life, but that's what you want to do. Uh, for me, I think life is the most important thing. Life is precious, so I like to focus on that the most. But I respect people who prioritize liberty, and I think you have the right to do that in your own home or in public space. Obviously, if you enter a private business and they're requiring you to wear a mask, you should wear a mask. You should respect that business's, right. And so, um, those are some of my thoughts. Let's go to the data. Okay, it's been 13 months since COVID-19 hit America, and there's the data. We started on April 2nd, 2020. And yeah, there were 5,911 people who have died at that time. And since then, over 500,000 people have died in 1 year and 1 month. Or yeah, 1 year, 1 month, and now we are at 576,616. So um, it's no cakewalk, right? In the last month, from April 2nd to May 2nd, we had around 23,000 people die, which is close to 1,000 per day. Um, God decided to be merciful in America. Maybe a lot of Baptists are praying, or maybe the charismatics. Charismatics like to pray, and they fast. They're kind of serious about their prayer. My dad's a Presbyterian, but he fasts. He prays for hours. It's kind of like a charismatic. There are charismatic Presbyterians. And so, but maybe a lot of people have prayed, and God has been merciful to America. So whereas from March to April, there were 40,000 deaths, it's decreased, cut in half in the last month. And still, you have, almost one person dying, 1,000 dying per day on average. So it's not cakewalk, it's a lot of deaths, but it's gone down. And we have to see what's going to happen by June. June 2nd, you could tune in for the anniversary show and see. So you can see on the screen there, what's been happening. So cases have remained steady in America. If you look at the third column, row, 30,606,648 people were positive for COVID. And on April 2nd, 2020, on May 2nd, 2021, on May 2nd, 2021, we have 32,382,541. So we've risen around, 2 million, which is similar to the rise from March 2nd to April 2nd, 2 million. So deaths have gone down, 50%, but positive cases are steady, holding at around 2 million per month. And so it's still concern because, death rate has gone down a little bit, but that, the infection is still at the same level. So it's a problem, and death rate can always go up, right? Based on whatever factors. So it's a matter of concern. But interestingly enough, that's not true for the world. Death rate in the world did not go down like America. If you look at the world COVID-19 death from March 2nd, 2021 to April 2nd, 2021, it went from 2,540,340 to 2,836,682. So you had about, a little bit less than 300,000 increase in death, right? 300,000 death. But if you look at the death rising from April 2nd, 2021 to May 2nd, 2021, we went from 2,836,682 to 3,187,378, which means he went up by more than 350,000. So there's a significant increase from less than 300,000 deaths to over 350,000, right? There's a spike up in monthly death rate around the world, and that may be because of COVID-19 spreading in third world nations, which is seeing a very sharp spike up, and second world nations. Specifically, India and Brazil have been seeing sharp spike in COVID-19 death in the past month, which is very tragic. And not only that, now it's spreading to nations around it. So South America is seeing a spike up as a continent, and Southeast Asia, like for India, it's spreading outward and it's beginning to see spike up. So next month, we may see tremendous number of deaths in other Southeast Asian countries, and other Latin American countries may see sharp spike up. So that's tragic. We may have over 400,000, 500,000 deaths in next month. Right now, it's gone up from a little bit under 300,000 deaths in a month to over 350,000 deaths. So at this projectile, we probably will have at least 400,000, if not over 500,000. It could be far more than that, because death rate can be exponential in different countries in Latin America and in Southeast Asia. We have countries like Pakistan, we have Sri Lanka, we have Vietnam, which is close by. So it could, Philippines, Indonesia, it could be spreading over there. And so, COVID-19 deaths are increasing in Africa as well. And so we may see a sharp exponential spike up in Africa, the continent of Africa, which can be tragic. And Germany and France and Italy has been struggling with COVID-19 death. It's not impossible to see sharp COVID-19 death spike in Europe as well. And let's not forget America. Yes, we had a good month. Easter to Easter, right? Because the April 2nd was like Good Friday, and today is Orthodox Easter. April 2nd was like Good Friday for Protestants and Catholics. So maybe God's giving us this 1 month from Easter to Easter as a gift to us, Um, but that doesn't mean this is going to be forever. We don't know. It's possible that America may see a sharp spike up in COVID-19 death. As you know, I'm calling 2021 year of the COVID mutants because we have a lot of COVID mutants from UK, United Kingdom, South Africa, Brazil, and now in India we have COVID mutants. We have COVID mutant in New York, and now in India we're seeing double mutants, double jeopardy, and that's now coming over to different countries around the world. So you may have a triple mutant, quadruple mutant. We don't know what's going to happen in 2020. It's still early, it's only May. So by Christmas 2021, I'm projecting 100 million deaths from COVID around the world. And I don't think I'm being impractical. I think mathematically, when you calculate the exponential growth, I think it's feasible that we can go to 100 million deaths by Christmas. If you see the graph of India in terms of cases and death, it's like it was going like this and then it went straight up. Let's say that happens in America. Let's say we have like, we have 4,000 deaths per day like in January. And now, we have less death. But let's say in the month of May, there's a sudden sharp increase in COVID-19 death and you see like 4,000 people dying. Because India a few weeks ago only had like 1,000 dying according to official record. But then it went to like almost 4,000 deaths, around 4,000 deaths. Matter of a couple of weeks, from 1,000 to 4,000. And that's what happened in America as well, around January. And so that can happen in May. So let's say, we have, around 1,000 deaths and it spikes up to 4,000. And let's say it continues instead of going down. It will hit 10,000. So if you have India hitting 10,000 deaths per day and Brazil hitting 10,000 deaths per day, America eventually hitting 10,000, you see what I'm saying? And you have like France and Germany and Italy hitting 10,000 deaths per day. Suddenly, out of nowhere, maybe because of India's double COVID mutants, maybe we'll have triple mutant jeopardy mutations that overcome all the vaccines in America. And people who are vaccinated suddenly start developing COVID and it's extremely deadly through triple mutations or whatever. I mean, this is scientifically possible. Then, I think 100 million people dying in year 2021 is definite reality, possibility. And I think Dr. Fauci will agree with me. Hi, Dr. Fauci. Just for the record, I've been more right than you, Dr. Fauci, on almost every prediction I had. So I expect to be right on this one as well. What's your prediction? How many people do you think will die by Christmas 2021, Dr. Fauci? People should be asking this question in Face the Nation, Meet the Press. This week with George Stephanopoulos, Farid Zakaria, Judy Woodruff, NewsHour. People should be asking questions like this. They need to get predictions from experts based on their field of expertise, and ask them what their projections are and why they think so. I'm presenting you with why I think we're going to have 100 million COVID-19 deaths by Christmas 2021. And I'm basing it on the data analysis and what we are able to see in Brazil and India, but also France and Germany. But we've seen also in America in January, we saw a sharp spike up to 4,000 deaths per day, if you remember. It may seem like ancient history, but it was a couple months ago. And so I think, I think I'm being rational and logical in saying that we can have 100 million deaths by Christmas 2021. Obviously, I don't want any deaths, I want people to live. And that's why I created this show. And it was a daily show when I started because obviously everything was new. People did not know where to go. They were kind of in a moment of panic and anxiety. And I felt like I needed to provide some answers and some direction, for people, especially in Virginia's 8th District, Arlington, Alexandria, Falls Church, and Fairfax County, but throughout the world because this is on internet. And many people survive because of this show. Let's be honest here. When Dr. Fauci was like, don't wear a mask, I said, wear a mask. And, people did not get COVID because they listened to my advice and ignored Dr. Fauci's advice. Let's be honest here, Dr. Fauci. I was right, you were wrong. It's not like COVID-19 infection patterns changed, right? You should have said everybody should wear a mask, but you said don't wear a mask. And Dr. Gupta said the same thing. World Health Organization said the same thing. When Heerak Kim, that's who I am, independent candidate for U.S. Congress in Virginia's 8th District, said wear a mask, right? Obviously, I'm prioritizing liberty, not liberty, life, over liberty. Because I think life is most important. If I have to rank it, I think life is most important, the liberty and the pursuit of happiness. That's how I rank it. But as I said, like there are people in my movement, conservative movement, who don't rate life as the most important. Like people who want to have a maskless worship service. Obviously their priority is not life because you could get infected without a mask, but they want to worship together in a crowded space. They're emphasizing liberty. I think that's a good thing. Your life is in God's hands. If you get COVID-19 worshiping God and you died loving Jesus, and there's nothing to be ashamed of. And, more power to you if that's what you want. But, obviously you understand the risk and you still want to go worship Jesus. That's great. At the end of the day, life belongs to the Lord. You could die from cancer, car accident, right? You could die from COVID. God controls your life wherever you are anyway. So it makes rational sense, for Christians who are like, I'm going to go worship God in church. If I get COVID, I get COVID, and I respect that. But, obviously you can recognize the possibility, you can't ignore the reality here. You can't ignore the science. But I understand some people prioritize liberty more. And, there are a lot of guys out there, who risk death to get a girl, right? To impress a girl, so, you know how that is, and love is like that. There are parents out there, you would give your life for your child, that's love. And so in the same way, a lot of Christians love God and they want to worship God in his home. So they sacrifice their life or risk their life, and so it's something that you can understand. And all the police officers should be able to understand as well. The power of love for Jesus. Like Kim Davis, one of my heroes from America, she refused to grant marriage license and was arrested and went to prison. She's my hero. That's why I have her picture right there, Kim Davis. Because, Romans chapter 1 says homosexuality is evil. God will send the wrath of God for homosexuality. God's not a liar. Are you calling God a liar? When Romans chapter 1 says God's going to send wrath of God for homosexuality, he will send wrath of God for homosexuality. He's not a liar. So if you promote homosexuality, you fight for homosexual rights, you got to expect wrath of God in your life, in the lives of your children. I think you got to expect that if you know that God's not a liar. And God's not a liar. When God gave the New Testament church in the age of grace, every American Christian in 2021, Romans chapter 1, as a guide, God's not a liar. When God says he's going to send the wrath of God for homosexuality, he will. He will send it to your family. He will send it to you in your personal life, your professional life. He will send it to your loved ones, your husband, wife, your girlfriend, your boyfriend, because God is not a liar. God's going to keep his promise to send the wrath of God to you personally if you fight for rights of homosexuals, lesbians, bisexuals, transgender people. So you must understand God is not a liar. God will whoop you. God will whoop you. God will whoop you if you protect gay rights, lesbian rights, bisexual rights, transgender rights. God will whoop you because God says he will whoop you. Why do you think God's lying to you? Doesn't matter if you're black, doesn't matter if you're Asian, doesn't matter if you're Korean, Japanese, Chinese, Filipino, Vietnamese, Indian, Pakistani. Doesn't matter if you're Arabic, Palestinian, Jewish. God says he's going to whoop you. He's going to keep his promise. He's going to whoop you. Romans chapter 1 is true. God is not a liar. He's going to whoop you. Doesn't matter if you're a Baptist Christian. It doesn't matter if you're a Pentecostal Christian. It doesn't matter if you're a Methodist Christian. It doesn't matter if you're a Catholic Christian. It doesn't matter if you're an Orthodox Christian. Happy Easter, or Easter Orthodox Christians, by the way. It doesn't matter what your denomination is. If you fight for gay rights, God will whoop you. God will whoop you because he says he will whoop you. Why do you think God's going to lie and not do what he says he's going to do? You know, let's be real here. God's going to whoop you if you fight for gay rights. God's going to whoop you. God's going to whoop your children. God's going to whoop you in your personal life. God's going to whoop you in your professional life. God's going to whoop you. Yeah, because God says he will whoop you. Why don't you believe him? This is why you don't have faith. You don't believe that God will whoop you for violating Romans 1. You're not a person of faith. If you fight for gay rights and you don't think God's going to whoop you, you obviously do not have faith. You don't believe that God will do what he will do. You don't believe that God will keep his promise to you, to whoop you if you fight for gay rights. And Romans chapter 1 is clear. And obviously it's harmonious throughout the Bible. Sodom and Gomorrah. You know what happened in Sodom and Gomorrah because of homosexuality? Deuteronomy, Exodus. It's all over the Bible. And so, yeah, God will whoop you. And God's going to whoop your children if you fight for gay rights. I mean, it's 100% certain. 100% certain. Because in the Holy Bible, there's nothing more evil than homosexuality. There's nothing more evil than homosexuality. You can commit a first-degree murder, that's okay, compared to homosexuality. One act of homosexual sex is far more evil than killing a family of 5 in cold blood after you rape every one of them. Yeah, that's how it is in the Bible. That's how serious God considers homosexuality. So, I mean, you know, don't be talking about gay rights here. You know, I mean, your laws are not God's laws. Your rules are not God's rules, you know, and God is above everything, right? God's rules trump every national law, local law, state law, professional organization, regulations, ethics codes, whatever. It doesn't matter. Because at the end of the day, God is supreme. You know, you're trying to separate God away from your life, away from institutions, and that's not how God wants it. Separation of church and state is not what God created. It's what you created. God doesn't agree with separation of church and state. So, I mean, you try to persuade God to separate church and state. He's going to say, screw you. I'm using colloquialism. Screw you. You want to separate church and state? Screw you. I am God. I'm God over everything. That's how God is. You try to reason with God after you die in hell, where you'll be there for eternity. You know what I'm saying? Yeah, but anyway, let's go to COVID-19 world cases. It's been spiking up. You know how in America it's like, 2 million or what is it? Yeah, US cases is like rising at, like 2 million is fairly steady if you see the pattern there. Although from January to February of 2021, it jumped 6 million, but at least from March to May, it's been fairly steady, right? 2 million. But look at the world. From March to April, in 1 month period, COVID-19 cases went up around what? 16 million, right? But from April to May, it went up like over 21 million, right? So cases are going up, mostly in the second world and the third world countries, led by primarily India and Brazil, but it spreads outward from India and Brazil to other countries. That's the problem. So we're looking at a serious calamity globally, And so Heerak Question Kim, independent candidate for U.S. Congress in Virginia's 8th District. That's me, Heerak Kim. I predict 100 million deaths, minimum 3 million people dying in America. I expect 3 million people to die in America because this is a global pandemic. And now there are more increased number of people not wearing masks. At a certain point, before we realize it, people are going to be infected with probably COVID mutants. And by the time we try to have public health recommend wearing masks, it'll be too late. There'll be too many people infected and spreading it. And the message takes time to get out, right? So let's say Center for Disease Control realizes that double mutation COVID from India is spreading aggressively in America, for example, and they want to shut everything down. It's going to take them few days, even a few weeks to get the research together, present the recommendations to Biden administration, and make the announcement. During that 2-week period, you can have tremendous number of infections that will eventually lead to tremendous number of deaths. Once the announcement is made, it's not like things are going to change right away. There will be like public debate. So from the moment that CDC discovers, it'll take about a month to kind of swing the country toward the direction of caution, for governors to pass laws to stay at home, whatever, it'll take about a month. And from the actual event to CDC discovery, it can take weeks or months even. Probably not months, but it could take weeks. So we're talking about a month and a half lag time. And by then, it may be too late to control the curve. Because if you remember, like over a month ago in India, they were seeing a pretty good statistics. They're like, oh, we're okay, let's celebrate, well, let's open up the country. They were in that mode, like the mode that we're in now in America. And as I said, once COVID-19 mutates aggressively, and we're talking about a country of 1 billion people now in India, you can have triple mutations, quadruple mutations. We don't know which direction it's going to go. It's like science cannot follow it because things are happening too fast. At a certain point, you may have strains that are dominant that can overcome every single vaccine. Triple doses of Pfizer, for example. They could overcome it without any problem. And when that happens, and I'm predicting it will happen in 2021, because you look at Brazil and India, I mean, probability that will happen is going up every day. Once triple or quadruple mutations happen, to the extent that no COVID vaccine will work, every American, 100 million Americans who are vaccinated, they're 100% vulnerable. It's like having no protection. So you can easily see 3 million people possibly dying in America. We don't know when this is going to happen. It could happen in May. There may be strains in India that we don't know of that can overcome Pfizer triple dose, Moderna triple dose, and Johnson & Johnson dose, COVAX, Russian vaccine, everything. 100% of the vaccines are kind of created on the same premise, right? Same type of research. And when the mutations start and they can all overcome these defense system, people will die. And there's nothing the Centers of Disease Control can do to stop it. I mean, only way is to stay at home, like we did in 2020. But the problem is if they spread more aggressively and they kill more lethally than in 2020, that's the nightmare, right? More deadly, and faster spread. And it can also become more airborne. Right now, there's a spectrum between droplet and airborne. What if COVID-19 becomes more airborne? Then there's a serious problem. So, there are a lot of factors that we don't know that are possible, and that's why I still feel my figure is conservative. 3 million Americans dying, because once there are strains that can overcome 100% of the vaccines, people will die, large numbers. And I'm predicting that will happen in 2021. Unfortunately, it could happen in May, it could happen in June, it could happen in July, it could happen in August, it could happen in September, November, December, any time. We don't know. All we do know is a lot of mutations are happening right now in Brazil and India. And obviously, there are a lot of other countries too. Let's not forget. And there's a lot of movement from Brazil to America, India to America, so it's logical, it's going to come. Yeah, so it's looking bad. It's looking bad. If you look at the 3 articles that I've chosen for us here today, the theme that I'm putting all of them into is millions to die from COVID in 2021. Obviously, my answer is yes. Yes. 100 million expected to die in the world. That's my prediction. Heerak Kim, independent candidate for U.S. Congress in Virginia's 8th District, Arlington, Alexandria, Falls Church, and Fairfax County in Northern Virginia. 3 million COVID-19 deaths in the United States alone. That's my prediction. As I said, yes, 100 million people got COVID vaccine, but that'll be useless if mutations develop that can overcome them without any, like 0% protection. It's possible that COVID mutants can emerge that will have 0 protection with triple dose of Moderna or Pfizer. It's possible. Scientifically, it's possible. And whether it will happen or not, we have to see. There isn't a scientist in America who disagree with that. They know it's possible. And so, yeah. Oh, by the way, I have good news. I acquired another certification. Now I am a certified nurse educator, CNE. So I took a national certificate exam, certification exam, administered by National League for Nursing, NLN, which is the first nursing organization in the United States of America, created like over 100 years ago. And they sponsored this certification exam for professors of nursing to be certified, because not all professors are created the same, right? So they have this standardized certification exam. It's very, very hard. I tell you, it's very, very hard. I took this exam a few days ago and I passed. So I'm now an officially certified nurse educator. I am one of the elite nursing experts who is professionally certified as an educator, certified nurse educator in this country, United States of America. I am top of the elite group by definition, by law, by regulation, one of the top experts of nursing education in America. Yeah, I mean, what can I say? Yeah, so yeah, I'm excited. I'm excited. I'm good. As I told you, I am the Leonardo da Vinci of 21st century. So there's no surprise in my being able to dominate a lot of different fields. I am the Leonardo da Vinci of 21st century. There's only like one of me coming around in 500 years. Every 500 years is like only one of me. Yeah. So yes, I'm not surprised that I am one of the top experts in nursing education now in this country. I'm officially certified. I mean, you know what certification means? Means you are certified officially as a nurse educator. How many certified nurse educators do you know? You know how rare we are? Certified nurse educators, you know how rare we are? In a given hospital, you could count in one hand certified nurse educators. That's how hard it is. In any given hospital, Innova Fairfax Hospital, hospital where I work full time as a registered Virginia Hospital Center in Arlington, Georgetown University Hospital. You can count in one hand in a big hospital certified nurse educators. That's how hard it is to be certified as a nurse educator. You know, among my nursing professors at Georgetown University, you can count on one hand people who are certified as certified nurse educators because it's that hard. As you know, I have a master's degree from University of West Georgia in education, Master of Education, therefore ergo educator. I have 4.0, I have straight A's in my Master of Education program at University of West Georgia, which is in the State University System of Georgia. Obviously, I'm brilliant, you know, as an educator. I have 4.0 average from Virginia State University in their Doctorate of Education, Doctorate of Administration program. And Virginia State University is HBCU, Historically Black College and University. Go Trojans! That's where the Democratic debates for Virginia's governor was, if you watched that. 4.0 GPA in their doctorate program in education. 4.0 GPA at American College of Education. That's where I'm doing my doctorate of education on urban education, how to train principals to become effective principals. So I'm focusing on principal leadership. You know, so, 4.0 GPA. So you see why I am certified nurse educator. I have my master's degree in clinical nurse leader from Georgetown University, 2-year intensive program. I am also a certified nurse, clinical nurse leader, CNL. And so, yeah, you're looking at one of the greatest experts in nursing field emerging and expanding to provide you with the kind of guidance you need to survive. You know, I am research oriented. I presented 2 papers, research papers already this year in 2021 relating to nursing research. I presented my paper at Clinical Nurse Leader 2021 Summit sponsored by American Academy, American Association for Colleges of Nursing, which is an accrediting agency, primary accrediting agency for nursing programs in America. It's Georgetown University's nursing program, I believe, is accredited by American Association, American Association of Colleges of Nursing. So they accredit a nursing program. So Clinical Nurse Leader is sponsored by American Association for Colleges of Nursing. And so I presented my research on wearing PPE in non-COVID hospital units. What kind of personal protective equipment should you wear in hospital units which don't have COVID patients, technically. So I presented my research on that as a research poster. And then Virginia Nursing Association, we had our 2021 spring conference, and I presented 25 minutes on medical surgical acute care for patients who had total hip surgery and total knee surgery, primarily, but orthopedic surgery patients who are immigrants, like immigrants from India or Africa or Korea, or China or Philippines, or Kenya, Egypt, wherever. So my 25-minute presentation is on that. How do you practice culturally sensitive nursing um, in your nursing care for patients who had surgery, total knee surgery, replacement surgery? Some of you watching this show may have had, your surgery. So I'm concerned about multiculturalism, culturally sensitive nursing care. So that's one of my expertise. So, my research is on that. And I'll be presenting at the International Conference of Sigma Theta Tau. As you can see there, I'm a member of Sigma Theta Tau International Honor Society in Nursing. So if you go to Brazil, to University of Sao Paulo Nursing School, I think they have a chapter there, international chapter. If you go to University of Beijing Nursing School, they may have a chapter there too. Seoul National University Nursing School, they'll have a chapter there. Busan University Nursing School, they may have a chapter there. Philippines, University, University of Philippines Nursing Program, they may have a chapter there. Sigma Theta Tau is global. We were supposed to have the annual international conference in Singapore, but it became virtual conference, unfortunately. But and so I'm presenting it on intensive care unit type of thing, which is if you have a heart attack outside of a hospital, it's called out of hospital cardiac arrest. Can we save your life or minimize the damage to your brain by lowering your body temperature, like in the ICU room, for example? So in the ICU unit, let's say at Virginia Hospital Center, you come there and let's say you're not dead on arrival. A lot of people have heart attack, out of hospital cardiac arrest. They die before they reach the hospital, like they die at home or that they die in the ambulance. So they're what we call dead on arrival, DOA. If you don't die before you reach the hospital and you get rushed to, let's say, intensive care unit, can we save your life by lowering your body temperature? Through different means. So, we can lower your body temperature through physical means, like ice, putting ice on you. We could do it through chemical or medical means by giving you medication that will lower your body temperature. So we call that induced hypothermia. So we lower your body temperature intentionally because it decreases the oxygen demand of your body. And it decreases certain processes that could damage your brain cells. And there are people who have heart attacks whose brain cells die and they could never be regenerated, who become mentally incapacitated afterwards, and they never gain their functionality back. Maybe you've met people who've had a heart attack and they're not the same afterwards because they die. And so so that's my research, and so it was actually my certified nurse leader research that I did over 1 year with Professor Margaret Nolan and Professor Kelly Anderson. And so Professor Kelly Anderson's expertise is heart, cardiology, cardiac nursing. So she presents everywhere. She's like the director of the PhD program in nursing at Georgetown. So I may do my PhD in nursing under her, guidance with her as my PhD thesis advisor. So it'll be like in the intensive care unit type of a research, and it will help all the intensive care units in America from nursing care perspective. So I'm thinking about doing that possibly. And Professor Margaret Nolan, she practiced as a nurse in the U.S. Army. She was a U.S. Army nurse, and so she was a helicopter nurse. So she's a nurse who goes with the helicopter to bring the patients and make sure they stay alive in the helicopter. She worked in the intensive care unit. So she's, she's critical care. That's like her specialty. Um, it's, so I've done research with them, and now, I'm presenting it at the Sigma Theta Tau International Conference. So, so look at this. I mean, you're talking to someone who's delivering paper on 3 different fields. One is critical care, intensive care unit type of research on how to help you survive if you have a heart attack in an intensive care unit setting. That's my, clinical nurse leader research, right? And I'll continue that. Maybe I'll expand that into my doctoral thesis under Professor Kelly Anderson at Georgetown University. I don't know. I mean, I'm still considering, I may go to Johns Hopkins University and do my PhD there. There are PhDs 100% online. Who knows? I'm still, thinking and praying about it, any school that has me is lucky. Let's be honest here. But anyway, you see here, so you're looking at a serious expert here in nursing. I mean, by definition, I'm a serious expert in nursing. I'm certified. Geez, I'm certified as a clinical nurse leader in the clinical setting. That's my expertise. I am certified as a certified nurse educator, for God's sake. I mean, as I say, in a given hospital, you can count the certified nurse educators in one hand in a given hospital. Any hospital, Innova Fairfax, Virginia Hospital Center, Innova Alexandria Hospital, you could count in one hand certified nurse educator. I am one of them. That's how good I am. You can count it probably in 2 hands, maybe more than 2 hands, clinical nurse leaders. These are not easy things to obtain. You know what I'm saying? But anyway, so you are very lucky that I provide you with analysis that is technically expert. Technically expert. I'm sure Dr. Fauci is watching this show because he needs my guidance. I have expertise that he needs in this time of COVID-19 crisis. I understand that. I'm considering maybe doing my PhD at National Institutes of Health. They need my help. They're struggling. Let's be honest here. National Institute of Health is struggling with COVID-19, and they're probably hoping I'll come there and help them, give them guidance, direction. I am the Leonardo da Vinci of 21st century, not just 21st century, 500 years. I am sure if I go to National Institute of Health, my brain will be among the top 0.01%, 0.001% superior intellect among all the researchers at National Institute of Health. I'm 100% sure of that. I'm sure you agree, Director Collins of National Institute of Health. Yeah, I mean, I let my record speak for myself, Oh, welcome to my world. I am the Leonardo da Vinci of 21st century. What can I say? I mean, you are lucky just to meet me because there's only one of me in 500 years. I know my patients appreciate me. I had a shift yesterday and all my patients love me. I took care of them really well. You may be lucky, if you need a hospital, come to Virginia Hospital Center. You may meet me, you may have my care. You may be one of the lucky ones. The articles that are important for right now are these 3 articles. Tragedies happening in India, and today is the beginning of Asian American History Month. May is Asian American History Month celebration. So, for those of you who are following me in Twitter, Heerak 4 Congress, Heerak number 4 Congress. You've seen my tweets on Asian Americans. I fight for Asian American. A lot of Asian Americans are being discriminated in America. I think that's not fair. People, Asian Americans who achieve should have their achievement recognized. And not be discriminated against, whether it's in the workplace or in the community or by individuals. I think that's wrong. Just go to my Twitter account if you haven't seen it yet. Heerak for Congress for for regarding May as Asian History Month. Tweets that can help you become informed. So I'm kind of focusing on India. India is in Asia, as you know, and it's tragic what's happening in India. As you know, I'm an adjunct professor at an Indian university in Bangalore in the state of Karnataka. A lot of people are dying over there. It's sad. So my heart goes out to them. So the first article, we're burning pyres all day. India accused of undercounting death. I mean, so many people are dying and it's hard to keep up with the death. You know what I'm saying? And this article was by Hannah Ellis Peterson and Mohammed Sartag Alam in the Guardian newspaper. And the significant quote from that is, India's official death toll has continued to rise relentlessly. On Saturday, that's May 1st, it was another record-breaking day with 401,993 new cases and 3,523 deaths. Isn't that incredible? 3,500. We were experiencing that a couple months ago in America. So we can relate, we understand what's going on. Yet, health experts widely believe the official figures do not come close to reflecting the real number of deaths. America is a first nation, right? And India is like a second nation. I think they're a second nation. I don't know, maybe they're first nation now. I don't know technically. I should probably do some research on that, but a lot of the areas in India are actually third nation. They don't even have electricity in some villages, working electricity. Even at my university, sometimes electricity goes out in Bangalore. It's a major city. Yeah, and it's it doesn't happen all the time, but it happens. So if you live in India, you know what I mean. Yet health experts widely believe that official daily figures do not come close to reflecting the real number of deaths. With COVID-19 patients unable to get into hospitals, hospitals are full. Many are dying at home without getting tested, so nobody knows whether they're positive or not. They die and they're sent to their crematoriums without a positive test. They go directly from home to crematorium. No one knows why they died, right? I mean, they died of COVID, obviously, but there's no testing. So state governments accused of rampant miscounting. I mean, some probably, I mean, how are you going to count people who die at home who's sent straight to crematorium to be burned? How are you going to count them, right? Over the past month, in the 1 month period, in the Karnataka city of Bangalore, that's where I am an adjunct professor at an Indian university. Over the past month in the Karnataka city of Bangalore, where case numbers are among the fastest rising in the country, that they call it the internet Silicon Valley of Asia, Bangalore. A lot of computer experts came out of Bangalore, who are now leaders in computer industry in America and in Europe. It's called the Silicon Valley of Asia, Bangalore. Microsoft has an office, like a building there. Every major silicon company that's major have their Asia headquarters there, or like a branch there. Where case numbers are among the fastest rising in the country, it may be, maybe originally infections came through that channel. Who knows? There's a lot of travel between the world and Bangalore because techies, IT people go back and forth. Where case numbers are among the fastest rising in the country, the figure for COVID-related death registered in the crematorium is twice as high as the official death toll. Twice. So if that's true, maybe like 7,000 people are dying per day in India now. If that's the case in other parts. You see what I'm saying? So the problem in the third world is they don't have the kind of healthcare system that we have in America and the reporting system. So it's possible that they're not able to track it like we can in America. And that's a serious problem. Because you got to get an idea. So when I say 100 million people are going to die, obviously I'm saying 100 people dead, whether they're officially counted or not, right? Second article, COVID-19 death toll in India could be up to 10 times higher than the official 200,000 figure. So they're saying it's possible that 2 million people have died already in India from COVID. Yeah. So do you see when I say 100 million people dying in the world by Christmas 2021? You see it's possible. From now to Christmas, if India continues this trade, they could have 10 million people die officially in India. Unofficial number, it could be 20 million. They have 1 billion people, right? That's only 1% of the country dying. So the second article is by Sophia Enkel, Business Insider. And the significant quote from that is, medical experts and frontier workers are casting doubt over India's official COVID-19 death toll as the country passed its 200,000 mark on Thursday. I mean, these nurses and doctors are dying in India. They're seeing all these people die. They're like, it can't be just 200,000 people. You see what I'm saying? So the first article talks about it from the perspective of crematoriums, counting twice the number of deaths as the official figures. The second article is talking about how the actual healthcare workers, like nurses and doctors, are seeing the death on the ground, and they're doubting the official figures based on their personal experience in the hospital with COVID-19 deaths. As you remember, in New York State, they were undercounting COVID-19 death too, right? And Governor Cuomo is under attack for that. So it happens in America too, but I think it was intentional in New York because he didn't want the heat, right? So he was keep feeding like underestimates, and maybe that's going on in India as well. But India doesn't have the reporting system that we do. So part of it is just that they don't have the network. India, which is in the midst of a devastating second coronavirus wave, reported 3,498 deaths on Thursday, according to health ministry data. It was the third day in a row the country recorded more than 3,000 deaths a day. But medical experts and frontier workers worry the actual death toll may actually be much higher. Much higher. Yeah. This is coming to America. So count on 3 million people dying in America in 2021. If you're a nurse, you know what I'm saying. Let's not be, the COVID-19 vaccine you received in November, that's no longer working, even without the variants. Pfizer, those you got, in November, December, that's no longer working. It only lasts for a couple of months. You can get COVID now. Any day you go to hospital to work as a nurse. You got your COVID Pfizer vaccine, 2 doses, like in November, December, you could get COVID tomorrow going to work. In Virginia Hospital Center, Innova Fairfax Hospital, Innova Alexandria Hospital, MedStar, Georgetown University Hospital, MedStar, Washington Hospital Center, Children's Hospital in Washington, D.C., Suburban Hospital, Sibley Hospital. You could get COVID tomorrow, nurses in this area, because your COVID-19 vaccine from November is no longer protecting you, your double dose Pfizer. You know what I'm saying. It's only good for a few months. You're no longer protected by your vaccine you got in November, because you got it because you were a frontline worker in November. You're no longer protected. Every nurse in Virginia is no longer protected if you got your double dose COVID vaccine in November and December. You're no longer protected. Let's face the reality here. You're completely vulnerable. You know, let's not lie to yourselves, right? Let's not lie to ourselves. You're not protected from COVID-19 if you got Pfizer vaccine in November 2020. You are not protected. Nurses in Virginia, nurses in Washington, D.C., nurses in Maryland, you are no longer protected with your double dose Pfizer vaccine from November 2020. Yes, you could get COVID and die tomorrow. You could get COVID, you could die 2 weeks from now. Yes, I mean, let's be honest. You know, I know some of the nurses are getting their third dose. I don't know if that's allowed. I haven't heard of any nurses getting a third dose, but I know some are getting their extra doses. But I don't think that's like a program yet. But you know, Dr. Fauci's like, oh, don't wear a mask. You know, for months he's like, don't wear a mask. You know, by the time a lot of people have died. You know, so Dr. Fauci's like still like, oh, should you get third dose or not? You know, blah 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 blah. You know, he's like one who hesitates is lost. It's like Dr. Fauci. Yeah, so COVID-19 death is coming for you, nurses in Virginia, Maryland, and DC. Those of you got your double Pfizer in November, death is coming for you. COVID-19 death. You're no longer protected. It's only effective for a few months, you know. I mean, they're saying it could be a couple of months, it could be, you know, certainly you're not protected, you know. If you hit the 6-month period, you're not protected. Yeah, this is May. So if you got your dose in June, that's 6 months. Do the math. Third article, Biden bans travel from the US to India beginning May 4th, exempts US citizens. So this article is by Josh Wingrove in Fortune, April 30th, 2021. Oh, that's good for you to police officers. If you got double Pfizer vaccine in November, you're no longer protection. That you could get COVID and die. Yes, all the police officers in Virginia, you can get COVID and die if you got double Pfizer in November. It's been 6 months. You're no longer protected. You could die from COVID. You can infect your children can die. Your wife can die. You're no longer protected. If you got double dose Pfizer in November, you have zero protection now. Most of you, maybe all of you. Yeah, let's be honest here. I know Ralph Northam doesn't raise these issues because he doesn't care whether you live or die. He's pro-abortion. I'm pro-life. I care about whether you live or die. Yeah, that's what I'm just saying. Let's be honest here. There's no need to lie, right? Let's be honest. You're no longer protected if you got your Pfizer double dose in October and November. You're no longer protected. Expect to get infected. Yes. See how I'm looking out for you when everybody's lying to you? I'm looking out for you. They don't care if you get COVID. You get COVID and die. They don't care. Well, 6 months ago, you got double dose Pfizer. You're no longer protected. Well, you're going to carry that card. Oh, COVID-19 vaccine card from November 2020. Expired. Your vaccine has expired in your body. Yeah. You got to take care of yourself. You know, stop trusting the government agencies. You know, the government bureaucracy is slow. You know how it works. Yeah. So the third article is Biden bans travel from U.S. to India beginning May 4th, exempt U.S. citizens. So you don't think like COVID can come through U.S. citizens? Biden's such an idiot. This is why I call him Tin Man Joe. He doesn't have a heart, but he doesn't even have a brain, right? If you want America to be protected from COVID-19 from India or Brazil, you gotta say zero travel. Like Joe Biden is such a, he's like, if you're a U.S. citizen, oh, you can come. If you're not a U.S. citizen, you can't come. He's such an elitist, this Joe Biden. I mean, I don't think he understands how elitist he is. He's discriminating. He's like segregating and discriminating, right? COVID-19 can come through U.S. citizens just as much as it can come through non-citizens or illegal aliens, Joe Biden. COVID-19 can come from illegal aliens from India just as much as it can come from U.S. citizens from India. Such an idiot, Joe Biden. I mean, geez, if you're watching the show, clap with me if you think Joe Biden is an idiot. Because look at this. What kind of idiotic policy is this? You either block out a country which is going to send you double mutation COVID mutants that could overcome vaccines, or triple mutants that we don't know about yet. You block travel completely, idiotic Tin Man Joe. Do you see why I have no respect for this man? He's going to get all of us killed, Tin Man Joe. He doesn't know what he's doing. He doesn't understand the science. He's such an elitist. It's like, if you're an American, you could go back and forth. What an elitist. And he's like segregating, right? Segregating, right? If you're American, it's okay. If you're not American, it's not okay. All right, well, you don't think American citizens can't transmit COVID from one hot zone to a non-hot zone? You see what I'm saying? I mean, do you see why I don't respect Joe Biden at all? Because he's not rational. He's not acting out of science. He's like using his liberal progressive ideology and, like doused with some kind of like American exceptionalism, he doesn't know what he's doing. He's probably more like, Trump than he realizes, They'll probably see eye to eye on American exceptionalism, But anyway, yeah, I mean, buy American though. I agree with that, Trump said it, Biden said it, I agree with it. But the problem with Joe Biden is he's trying to like act like he's like a liberal, when in fact he's a closet Trump supporter. You know what I'm saying? I mean, you got to see through the guy. But the problem is this: Trump is not this stupid. When Trump said don't come from a country, he just said don't come from countries. He just blocked out a whole country. Like he blocked out China, right? Remember when he blocked out travel from China? He blocked everything out. Trump is rational, and that's why I respect Trump. He is rational, and he's guided by science. He's not like irrational like Tim Manjo is. Tim Manjo is absolutely irrational. Maybe he's going senile. Who knows? I mean, we know Trump is not senile because he makes rational decisions, right? So looking at the article, it says President Joe Biden banned most travel to the US from India beginning Tuesday as the country struggles to combat the worst surge of coronavirus cases in the world. White House Press Secretary Jen Psaki said that the US Centers for Disease Control and Prevention recommended the ban. Did they say ban for everyone, or did they say, oh, do not ban US citizens? See, I would probably think the Centers for Disease Control said ban everything, right? But it's probably Joe Biden and his exceptionalism, like white privilege. Oh, let's not, let prevent the vacations of Americans who want to go to exotic India, that kind of thing. Yeah. It's like what Edward Said called Orientalism, It's like, yeah, let's block out the Indian local Indian denizens, natives. But, if you're US citizen, you are part of this like, colonizer, white privilege, so you could go. You know what I'm saying? This is exactly what Edward Said referred to as Orientalism, this is what Joe Biden is, he's racist, I mean, let's be honest here. He's being racist with this decision too. I mean, segregating like the country into two different parts, like in Israel, like you segregate Palestinians as like less than human. And then if you're Jewish in the Jewish state, oh, you're like a human being. If you're a Palestinian person of color, you're like 3/5 of human. You know what I'm saying? This is the kind of mentality that Joe Biden has, state of Israel has. It's like a racist mentality. Like, you're not fully human. You're just like 3/5 human. You don't have the right to come to our country. But if you're fully human, 5/5 human, then you can come to our country. You know what I'm saying? This is so bad. I mean, this is what I mean. Like liberal progressives are such racists, like Joe Biden, such a racist. And this is like the most racist thing, You've seen, like in the last few days, right? You'd agree with me. It's irrational. What Joe Biden is doing is irrational. In light of extraordinarily high COVID-19 caseload and multiple variants circulating in India. So it's not going to come through US citizens? You're probably knocking on your screen to say, what happened? The screen froze. Yeah, that was a traumatic effect. Sometimes silence speaks louder than words. You see what I'm saying? But yeah, I mean, we are going to die under Joe Biden. We are going to die under Tin Man Joe. My heart bleeds for America because we have Tin Man Joe as president. This is the greatest tragedy that could happen to a country. Look at what Tin Man Joe is doing. He's like opening up a channel for double, triple, quadruple mutation to come and kill us. Look at this. Tin Man Joe doesn't know what he's doing. You see what I'm saying? Center for Disease Control says block India, and Tin Man Joe is like, oh, let's still create like a pathway for COVID-19 mutants to come into America through US citizens. You see what I'm saying? I mean, have you seen anything more ridiculous than this? Yeah, we're all gonna die under Tin Man Joe. I mean, not all of us are gonna die, but many of us will die because of Tin Man Joe. Look at what he's doing. The policies don't make sense scientifically, rationally, right? This is what I mean when I talk about liberal progressive. They do not make policies that make logical, rational, scientific sense. Yeah, but anyway, I got a visual due here, but stay safe, okay? Don't go to COVID hotspots like India and Brazil and Chile, and more hotspots are emerging. I mean, do not go to your death, And please do not bring it back to our country, United States of America, from like Brazil, Chile, or India, or France or Germany, where there's like proliferation of COVID. Please do not bring it back. We have to look out for ourselves. And so the first step is to make sure we don't bring COVID-19 from hotspots to our nation, right? That's what borders are for. See, Joe Biden doesn't believe in borders. He believes in open border for all kinds of criminals to come in through America, right? Drug traffickers, gangsters. Now COVID-19, it's consistent with his irrational way of looking at protecting the nation. Right. This is why a lot of people are going to die under Tin Man Joe, because he doesn't know what he's doing. He's consistent in his irrationality. You see what I'm saying? Right? This concept of open borders, it governs his way of looking at American security so that none of us are secure. You see what I'm saying? None of us are secure. We are not secure from the drug traffickers. We are not secure from sex traffickers from Mexico. Open borders. We are not secure from terrorists who are coming in through these open borders. We are not secure from COVID-19 coming in through our open borders. Now, Center for Disease Control says stop migration from India, so COVID-19 cannot come in, so we can save American lives. And what does Tin Man Joe do? He's going to open up a pathway for COVID-19 to come into America. See, your safety is jeopardized because of this Tin Man Joe. I would worry if I were you, especially if you have children, because COVID-19 it's killing younger and younger people in their 30s and 20s. We don't know what the mutations are going to do in American setting. Yeah, I mean, expect us to have like thousands of deaths in the near future, thousands of deaths per day. And especially if you're a policeman, fireman, nurse, doctor who got COVID vaccine, double dose in October and November, remember, you have zero protection now, 6 months later, zero protection. Don't forget that, zero protection. Your COVID-19 vaccine card has expired. Expired. You're lucky that I care about you enough to bring your attention to this life threat that you are currently in from COVID, because your vaccine effectiveness has expired in your body. You're lucky that I'm going to tell you the truth, because Tin Man Joe will not. Tin Man Joe lies to you. He provides a pathway for COVID-19 to come in and infect you and kill your children. That's what Tin Man Joe does. But Heerak Christian Kim, independent candidate for U.S. Congress of Virginia's 8th District, I care about you, so I'm not going to lie to you. I'm going to tell you the truth, and I'm going to bring your attention to your risks that you are facing right now in COVID-19 America. You do what you want with them. I'm not going to tell you what to do. As I said, you have the right to life, liberty, and pursuit of happiness. You prioritize whatever you want to prioritize. If you want to risk the lives of your children, go right ahead. I mean, I don't think you should, but hey, they're your children. You do what you want. Parents know best, right? I mean, hey, you do what you want with your children. I recommend you don't jeopardize the lives of your children. That's my recommendation. But at the end of the day, they're not my child, they're your child, right? Hopefully you have more than one child, because if one of your child dies from COVID, you have no children. So make sure you get more than one child, because you got to expect at least a child to die in COVID-19 America, right? And this is like forever. It's going to go on and on and on. So you should assume, if you're a parent, like if you have one child, there's a high probability he could die. Yeah, I mean, there's a probability all three of your children could die from COVID, but it's less. It's like chicken pox, you get like one chicken pox for a child, all three could get it, but some suffer more severely, than others. Yeah, but anyway, yeah, I am looking out for you. I'm looking out for you. I'm looking out for you, because I bring your attention to something that is a fact, scientific fact, based on research. And that's what Tin Man Joe does not do, right? And you're going to follow him into COVID-19 death? Is that what you're going to do? Yeah. Remember, you make your own pathway in life. Don't follow leaders who are going to lead you and your family into destruction, because that's going to be on you. That will be on you. Well, I hope you enjoy my COVID-19 update episode, 13-month anniversary show. And I hope that it will help you survive COVID-19, especially if you're a nurse, doctor, or policeman or fireman who got COVID vaccine in October and November. You're lucky you watched this show, because probably nobody pointed this out to you yet, right? Yeah. So I'm looking out for you. I'm looking out for your interests. So you are lucky that I am the good shepherd, right? Think about it. If it weren't for me, where would you be? I mean, let's be honest here. So you are very blessed that I created this show 13 months ago. And obviously you could go and watch every single one of the episodes. Because it's no longer a daily show, because COVID-19 has been around for a while. So you could always watch my previous episodes for information. I'm just giving you relevant updates. So yeah, so hopefully today's show helps you and your family survive COVID. So hopefully you're alive at the 14-month anniversary episode, I'm hoping. Make sure you think seriously about what I said, right? Because this show was created to save your life. I hope that you'll be well, and that your family will be well too. Bye.